Within this framework, there's a discussion of clients coaching their therapists. What is coaching?
So what is coaching? It's a great question. A lot of people think about coaching as something that comes from the therapist. The therapist's coaching the client, healthier coping skills, being more adaptive and so on. But we think about it as something that comes from the client. Coaching is reflective of the client's agency, their wish and their will to overcome their pathogenic beliefs, to feel safe enough to explore their inner world, their emotional life, their relationships, to explore traumatic experiences that have been difficult for them. Person needs to feel a certain level of safety for that. And we think that patients need to let the therapist know important information about them so the therapist can be in the best possible position to be helpful. So this concept of coaching refers to the patient informing the therapist about what's likely to be helpful, what may be unhelpful. And this is where it relates to testing, is that they may give the therapist some clues as to how the therapist might pass the patient's test. Now, this is where the sort of theory around unconscious mental functioning comes in, because it's true that some coaching is explicit, it's occurring at a conscious, explicit level of functioning. Patient may come to therapy and they may think before they enter the session, I really want to talk about this issue. I really need to tell the therapist, this is my main problem. And they'll be very clear and they'll be very explicit about that. But we think in many cases, people are coaching without necessarily being aware of the full extent of what they're communicating to the therapist, but that there's a coaching quality embedded in their communication, oriented around priming the therapist and helping the therapist be as helpful as possible to the patient.
So coaching isn't necessarily conscious or overt on the part of the patient.
Correct. Yeah. It could be, but there are times when it's where it gets complicated is that sometimes something that appears to be coaching could be testing.
Right. So would it make sense now to say what is testing?
What is testing? Sure. So testing is what we do in the world to inform ourselves. We all test our reality, for example. We test our beliefs, and we think that patients do this too. They test their beliefs in therapy. We think people are testing their beliefs in their relationships with others as well. But a test is it's sort of like a trial. It could be a trial behavior that the patient tries out with the therapist to see, will the belief that's being tested, will it hold up? Or is it something that I can maybe question and undermine a little bit? So we think that patients are highly motivated to test their pathogenic beliefs because these beliefs are getting in their way. And the patient doesn't want the belief to be true. You have a patient who believes that they're unlovable. That's an extremely painful way to live. And we think that the patient's highly motivated to overcome that belief. So they're going to test that in the relationship with the therapist. Will the therapist treat me in the way that my belief predicts I should be treated? Will the therapist treat me with scorn or derision or be rejecting? Or will the therapist want to be interested in me and show some acceptance and warmth? Often what gets carried into a test is some behavior or attitude that's reminiscent of the traumatic circumstances that gave rise to the belief in the first place. So, and testing can happen in different ways. So a testing could take the form of the patient telling a story. It comes across in a narrative description of the patient in the world with significant others. And they're basically scanning the therapist to see how the therapist is responding to that material. Will the therapist pick up on what's being tested in the material and, sort of do something with it that could help the patient disconfirm their pathogenic belief? A test could be in the form of some kind of a question or demand that's posed of the therapist, or the patient could engage in some kind of behavioral kind of enactment with the therapist to see what the therapist does, how the therapist handles it. And this is all thought to be for the purpose of helping the patient disconfirm or overcome their pathogenic beliefs. Pathogenic beliefs are very constricting. They're very endangering. no one wants to really believe that these beliefs ought to be adhered to, that they are fundamentally true, that they should hold on to these beliefs. So sometimes the patient will pose a very dramatic kind of test as a sort of robust way to work on finding some exception to the belief and undermining it and seeing that it could be different. Basically, a test is kind of like the patient asking the question of, can it be different than what my pathogenic beliefs predict?
So can you give us, like, what would be a useful belief, pathogenic belief, to work with to maybe find some examples of testing?
Well, so I mean, you could work with any pathogenic belief and think about how it could be tested in
So if we were to
therapy.
say, like, if we were to use the I'm unlovable, what would be an example of testing that belief? Like, how might that look?
Well, a person could describe themselves in a bad way. They could really build a case against themselves in the narrative that they present to the therapist, or even in the way they present physically and behaviorally to the therapist. They might even make themselves seem insufferable to the therapist to see if the therapist will be able to recognize that there's still something good about the patient, that the therapist can see through that kind of bluff, if you will. And we would theorize that the patient is behaving in a way that's in compliance with the pathogenic belief when they do that. And so if I believe that I'm bad in some way, I'm defective, unlovable, they could present themselves as having, I don't know, a patient could talk about how terrible they are, or they could talk about how disturbed they are, or they could present themselves in a way that makes the therapist, really wondering, can I work with this patient? But we would hypothesize that this might be a test of the pathogenic belief, this kind of self-hate related pathogenic belief, by compliance with the belief.
There are also times where patients will the opposite of the belief to see if the therapist supports.
That's right.
So what might that look like in
So
this with a similar?
yeah, so we call that a test by non-compliance with the pathogenic belief. Maybe this patient who has a lot of self-hate related pathogenic beliefs would present something really positive, present something that they did that, they might tentatively, think is worth celebrating. They might sort of present that to the therapist. They want to see if the therapist will elaborate on that and support them in this positive view of themselves.